No, thank you. That is absolutely true about the introduction, is I do have an art degree, and then I'm now a children's nurse, and I was a ward sister at Birmingham Children's Hospital. And it was my pleasure to meet Deirdre when I was just got the sister's post, and we started to nurse the first liver transplant patients. And actually, Graham Gore, he was a student on my ward, and I allocated him liver transplant patients, and we worked it through together. The first one, yeah, and we wrote papers together on changing the service at Birmingham, so I'm very proud to have done that and to be where I am today. Thank you, Deirdre. And this is Alex, who works for me as a senior research assistant in the research centre I now have at Coventry University. And it's a really exciting project that we have because it's about making the most of technology, and it's going to be a dedicated project developing a transition app for young people, and it is the first of its kind for liver disease. So we are really pleased to be doing this project that CLDF have funded. It's 18 months in length, and it's for 16 to 24-year-olds. You're all going to say to me at the end, well, why not other ages? And actually, we're starting to realise that. When we went to Leeds with Anouk, we realised that actually there's the pre-transition group want them, and the parents said they wanted an app. But this is the start. We've just started this process of thinking about this and thinking about how we can actually use technology in these processes. You know, not to say we're replacing it. This is not the be end and all. It's not for everyone, but how we can use it cleverly, if you like, in a smart way. And how a mobile phone might be able to help us in this process that we've had lots of conversations today from James and Jenny. Now, the research team, the co-applicants are here. It's very important to say that it's all three centres involved in this. So it's Leeds, Birmingham, and it's King's College London. So we're all together in it. And these were the initial names here, the co-applicants, but gradually our team is getting bigger and bigger with Anouk, Lynn, Philippa and Monica, who've been helping us in Leeds and Birmingham to recruit and bring the patients and families to talk to us. And we're now starting to work. Just this week I've talked to King's College, and we're going to be working with them. So we'll be coming on your door, Anna and Jenny. You're next. And so that's really exciting, because it is about those three sites and bringing young people to the events that we've been running from those areas of the north, west and south of England. And it's the three major providers, as I've said. How we're doing the project is, it's really important to get the best evidence, if you like, in terms of this field, in terms of transition, using apps, using technology and connecting that to liver disease. And I'm going to let Alex talk to you about that and what we've found so far. This project's also about asking young people what they want. That's the important thing. We're going to say this at the end, but I'll say it again now. This app is being designed by them for them. The by them for them is really important in the words. And if that's all you walk out with, then I've been successful in what I'm trying to say. But we are asking the families, because they're coming along to the events as well. It's really important to get their views and your views on learning the things that would be really good to have in these apps. You know, what links should we put them to? You know, what signposting should we have? It might be we have different folders for different areas. We're just learning to listen at the moment, and that's the important thing. And the professionals are coming along, and I hope they're enjoying the bowling. And we're having a really exciting focus group in a bowling venue. I've discovered Alex can do bowling and I can't. That's probably why he chose the events. And these are all very arts-based kind of focus groups. So when people come into the room, we're using an arts-based approach to make it fun, to make it, you know, bringing people's views forward without it feeling too threatening. But some families have said, can we just do this on the phone? Because actually we can't get to the event, it's not a convenient night, or it's not in a convenient location near me. So the answer to that is yes. We're also doing telephone interviews, and if anybody wants to speak to us at the end, we'd be delighted to give you our cards, and we're very happy to speak to you. And then obviously we have to bring all this data together. So I'm going to hand over to Alex to talk about the literature review.
So the first thing that we did is trying to find out what research has been done previously. So we conducted a narrative type review, narrative looking at thematic issues, but done in a replicable way, so it was quite a comprehensive review with very strict inclusion-exclusion criteria, so we knew exactly what we wanted to find out. So we tried to focus on using technology So looking at how technology could be used to support transition for young people.
I'm sorry.
That's right.
Sack me.
So we soon found that such research didn't really exist, specifically for liver patients, young people with liver disease. So what we did, we tried to cast it a little bit wider. So we tried to take it in two different halves. So we were looking at the use of technology to support transition, and then ways that you might support young people with liver disease to transition. So it's basically the two separate parts sort of put together. So some initial sort of findings were that the use of mobile apps hasn't been well researched. It hasn't been extensively researched yet. But the use of text messaging systems, so SMS reminders, and there's some initial findings that suggest they might be helpful, particularly to do with adherence to alarm systems, basically to prompt people to take medicines, or even to record when medicines are being taken. But the three main things that the research suggests is that knowledge is probably the most important thing. So in terms of like lifestyle information, but also specifics. So actually what you would want to know about your condition, for example. And like I said, the medical reminders, the literature suggests that those are the three main things that technology perhaps could help with. But there's things that we don't really know about from using the literature. The use of peer-to-peer sort of networks, how they would work. Some previous research has suggested that sharing of information needs to come from like trusted sources, from experts, rather than coming from friends to friends. But that's something that we're going to investigate further in the focus groups.
Okay.
Yeah.
So leading on, it is a new area, and that's why it's really important to undertake these focus groups, because if we were guided just by the literature, we might sort of decide all sorts of reasons about it. But actually, doing the focus groups, so far we've actually undertaken 2 focus groups, and we've had in total 17 that we've spoken to. And I say we're open. We've only just started doing this part of the work, and so that's exciting already. The young people's knowledge was good about the disease, but there were concerns over the practicality of transition. Things like, if my liver was to pack up and collapse, where would I go? Who would I go to and see? And, it was one young person. The importance of communication, James has already stressed that in what he was saying about listening more, both to parents and patients. Have a nurse that can be contacted if there's a problem. So there you are, Jenny, there's your lead in, perfect. So those things have come up already in the workshops, and we asked them about their experience of transition, both what was good and what could have been better, to draw out those sort of positive messages. In terms of the app, one of the things that's come out is that it must be clear information. You don't want it too medical, this is what somebody said, but you can have the medical aspect, but you don't want something too sciencey. I think that says it all. Clear, trusted, a bit like Alex has just said that the literature's saying, that they want this honest, clear, but not too sciencey, thank you very much. And both the young people and the professionals suggested that an app should contain relevant lifestyle, not just the disease information, which, we're hearing those messages throughout the day, really, because it's that sort of those are the longer issues. Jargon buster. In both the workshops we've done, that's come up about glossy of terms, jargon buster, whatever you call it, but try and unpack some of these words for us that are constantly mentioned. The app should be clearly laid out and attractive. In our workshops, we've got a number of apps that we show them and on mini iPads, and time after time after time, the ones that has come out the best app, it's not obviously a liver one, because hopefully we're going to have that, but it's the Young Minds one, which is very interesting. I don't know if you've ever seen that, but write it down, have a look when you get home. It's very clear. It's got very clear front pages. It's got very clear folders in it. And that has been the most, if you like, popular one, Young Minds. In fact, it won, App of the Year for this age group last year, and had a lot of funding from the Department of Health. So it's interesting that that's been chosen again. Clear logos, symbols, eye-catching, colourful and contain pictures. So those are the sort of things that we'd be thinking about. What happens next is we pull all that data together in the next year, and we obviously got to work with King's College, and then we pull it all together. We're going to do one more expert workshop, which I'm going to host in Coventry, and invite young people with workers from Leeds, Birmingham and London to it. And there they will work with the designers to actually design the app. So this is very much an interactive outcome product, if you like, of a research project. So I hope that's really exciting to you all. One of the things that you kind of, it's a kind of a side plate, but actually it's quite interesting to know. When you now design an app, because this is going to be both in Android and in Apple, when you design now an app for Apple, it has to have something knowledgeable in, because Apple have been so concerned about the quality of apps. So you have to have some kind of quiz and some kind of knowledge testing. So that will be in it, and we've been asking about that. Our ultimate goal, as I've said, is for an app designed by young people, for young people. That's our ultimate goal for this. And then we will be doing, as a team, an evaluation. Thank you very much.